Alright, so the role of pancreas in regulation of blood glucose is quite simple. For my clinical students, we just finished discussing diabetes mellitus, and we even discussed drugs for treating diabetes mellitus. So in diabetes mellitus, we spoke a lot about the pancreas because the two hormones that are important in regulation of blood glucose are produced by the pancreas. That's the glucagon and the insulin. So insulin is working towards what? If there's too much glucose in the body, break the glucose down. Then glucagon is what? Is working at, okay, store glucose. That's convert glucose into the storage form, which was glycogen. You get? So these two hormones, they play a role. And since they are produced by the pancreas actually has an important role. Okay. So the question was what? The pancreas as an organ plays a pivotal role, that's a main role in regulation of blood glucose. So you should actually what? Discuss. All right. So let's move. The pancreas is like the body's glucose traffic controller. You must actually what? Say that. You get. So it actually maintains the balance and order in blood glucose levels. If blood glucose levels are too much, you break the glucose down. You store some. Okay. Blood glucose levels are reduced. The stored glucose, you break it down to form glucose again. All right. So insulin production. Beta cells in the pancreas produce what? Insulin. So if they ask you this type of question like this, they are looking forward to hear things, the names of the cells that even produce the hormone. Alright. So insulin is a hormone that lower glucose levels. It's just encouraging use of glucose and all that. So when you eat, your blood sugar rises and the insulin helps the cells to absorb glucose for energy. Okay. And storage as glycogen in the liver and muscles. Okay. Then how about glucagon production? Alpha cells in the pancreas produce glucagon, which is a hormone that what? Raises blood glucose levels. So as insulin is all about break down glucose, reduce levels of glucose, glucagon is all about what? Increase the levels of glucose. Yeah. So when blood sugar levels is low, glucagon signals the liver to release the glucose that was stored as glycogen. So it will release it back into the bloodstream. So I've already spoken about the glycogenolysis pathway, which is you see glycogen be converted to glucose 1 phosphate and all of that, right? So it's just these things talking about them different. Okay. So how is this regulatory stuff done? What is the regulatory balance? So insulin and glucagon work in a delicate balance to keep blood glucose levels within a normal range. Okay. So this balance ensures that cells have enough energy without the blood sugar levels getting too high or too low. All right. So without the pancreas regulation, conditions such as what diabetes mellitus can arise when blood glucose levels become dangerously what unregulated. Right. So that's the role of pancreas, the role played by pancreas in the regulation of what blood glucose.